In this scan, we will be doing the eFAST scan. eFAST stands for Extended Focused Assessment with Sonography in Trauma. For this scan, we will be using the low-frequency curvilinear transducer. We will be combining the right upper quadrant, left upper quadrant, pelvis, subxiphoid cardiac, and lung scan. Each of the views demonstrated in this video are outlined in more detail with their own video in this series. Please ensure you have practiced each of these views separately before combining them in the eFAST scan. The eFAST scan starts with the right upper quadrant view. The transducer is in the coronal plane. The initial depth should be set appropriate to patient body habitus. Identify the liver, the right kidney, and the hepatorenal interface. Tilt the transducer anteriorly, then posteriorly to visualize the space in its entirety. Then rock the transducer cranially to visualize the diaphragm. Next, the left upper quadrant view. Identify the spleen, left kidney, and the splenorenal interface. Tilt the transducer anteriorly, then posteriorly to visualize the space in its entirety. Then rock the transducer cranially to visualize the left diaphragm. Next, move the transducer to the pelvis. Place the transducer in the transverse plane as close to the symphysis pubis as possible. Tilt the transducer caudally to visualize the bladder. Identify the structures posterior to the bladder, in this case the prostate and the rectovesical pouch. Tilt the transducer caudally, then cranially to visualize this space in its entirety. Next, perform the subxiphoid cardiac view. The transducer is in the transverse plane and placed in the subxiphoid space. Within this space, slide the transducer cranially until the liver and then the heart is visualized. Asking the patient to breathe in may improve visualization of the heart. Identify the right ventricle, left ventricle, interventricular septum, right atrium and left atrium, the myocardium, and the brightly echogenic pericardium. Tilt the transducer anteriorly, then posteriorly to visualize the entire heart. Then move the transducer to the anterior chest. The transducer is in the longitudinal plane. Place the transducer in the midclavicular line in the second rib space. Identify pectoralis major and deep to this a rib in cross-section, visualizing the hyperechoic anterior surface casting a posterior acoustic shadow. Slide the transducer caudally to visualize 3 ribs in one view. Between each rib is a rib space. The hyperechoic line visualized in each rib space is the pleural line. Closely inspect the pleural line during respiration and observe for pleural sliding. Pleural sliding is confirmed by a to and fro shimmering effect at the pleural line. This is sometimes referred to as marching ants. Continue to observe for pleural sliding in each rib space as you slide the transducer caudally and laterally until the liver is reached. Then move the transducer to the patient's left and repeat this process. In this video, note the presence of normal A-line and comet tail artifacts. And this completes the eFAST scan. Clinical note. This scan is most frequently performed in trauma, assessing for the presence of blood or other types of fluids in the abdominal cavity, hemoperitoneum, in the pericardial space, hemopericardium, or in the pleural cavity, hemothorax. This scan can also be used in non-traumatic patients, assessing for the presence of either blood or other types of fluids in these spaces.